I am Dr. Shamil Wanigaratne, the acting head for the National Rehabilitation Center Research Section. If you ask me what is the main objective of the research section of the NRC, first of all, it's part of our mandate to conduct research and studies in the area of addiction. Also, there is a real need for local data. Unfortunately, there is little research on addiction in the region. So there is a real paucity of local data. So one of our main objectives is to do research to collect local data. It's also part of the UAE national strategy to conduct research. It's also part of the strategy in relation to that with the Abu Dhabi Department of Health. They have a research strategy, and our NRC research strategy is aligned to the Abu Dhabi Department of Health. We are also a WHO collaborative center, which requires us part of our remit to do research. So there's a number of reasons. And we have a number of international collaborations to do this. So we are not doing it on our own, but we have the many international collaborations. I won't list them right now. So those are the objectives of our department. What are the topics we conduct research on? We conduct research on many areas which are from biological, so I would, if you ask me to list them, I would say from epidemiology, that is surveillance, public health research, include cultural, social, sociological and anthropological research. Basic science research, for example, the effects of new psychoactive substances and translational research, pure research like genetics, pharmacology, medical and health consequences of substance use. This we are looking at how taking drugs affects your physical health, not just the mental health. And we got a grant from the WHO to conduct a research on the medical consequences of drug use, which is in progress. We look at comorbidity, so addiction, drug and alcohol problems doesn't occur on its own. It occurs with other problems like mental health problems, physical problems. So we look at how these combined problems affect the individual and how we can find better ways of identifying and treating. We do research into health policy for intervention and dissemination. We recently became International Technology Transfer Center, an ITTC. And ITTC is a global body which is particularly concerned in implementation research. You know, how we implement findings that are the latest findings into practice and how we evaluate it. So part of the NRC's mandate is to do prevention work, and we have started a universal prevention curriculum training. So the research section is now evaluating the implementation of this training. So those are the areas that we do research. In terms of partners, I can list you a long list of partners. We have I can say that we have MOUs with with National Institute of Drug Abuse, which in the US, the University of California Substance Abuse Center, McLean Hospital, Aberdeen University. We are working on MOUs with King's College and Implemental, which has expired. We have working on MOUs with the AMICA, Africa and Middle East Congress on Addiction, and also the International Society for Addiction Medicine. That is to show a few. We also have MOUs with local universities, Abu Dhabi University, United Arab Emirates University and Zayed University. So when we do research, we find expertise from these institutions to work with us. So it's a collaborative research. If you ask me what are the interesting findings, of course that is very difficult because we published many papers. I think in the recent years we have published up to 32 papers based on our research, and it's very difficult to say, okay, this is an interesting finding, but what we have found is our trends in drug use go up and down, it changes, we have to be very quick to respond. There are new psychoactive substances in circulation in the UAE, which is, we need to respond to that because new psychoactive substances are not necessarily fall into the legal framework, so we have to have a good, quick response to this. And also, we are beginning to look into behavioral addiction. We did a preliminary study, a pilot study with Abu Dhabi University, and we found that internet gaming disorder, which is a behavioral addiction, is very high prevalence, much more than any other country data. So we are now trying to do a national study based on that pilot. And the first step of the national study is we are just about to apply for ethical clearance to do a UAE-wide study of clinicians, or a survey of clinicians, as to how they see the behavioral addictions, whether they see many. We ask them to estimate it and to see what types of behavioral addictions we see. So in conclusion, I can say that it's part of our mandate to do research. We have a number of drivers, including UAE national policy, and our obligations to the WHO. We have conducted research for the last 15 years or more. We have published over 32 papers, and we have a broad spectrum of research. They go from pure research to survey-based or epidemiological research. So this is very much part of the NRC, and a very important part of the NRC. We wish to contribute not only to the UAE knowledge base, but to the global and international knowledge base. Thank you.